Smartphone technology might help us track the COVID-19 pandemic, but it could also do permanent harm to our privacy and digital rights. What price is worth paying to defeat the coronavirus outbreak? Is it worth giving up our privacy? While doctors and nurses are working hard on the front lines, governments around the world are increasingly using surveillance tactics to monitor the effectiveness of their lockdowns. China was the first to deploy drones, as well as smartphone tracking and facial recognition to make sure people weren't going out. Poland recently launched a home quarantine app so people under quarantine can send selfies to inform authorities that they're home. The app informs police if users fail to respond in 20 minutes. Now, the UK privacy watchdog says the government should have legal powers to use people's phone data to tackle the virus. Some police forces have launched online portals for people to report the details of those not abiding by stay-at-home orders. Digital rights activists say while technology is needed to save lives, these moves will potentially infringe on rights to privacy.
Governments around the world are demanding extraordinary new surveillance powers intended to contain the virus spread. Many would invade our privacy, deter our free speech, and disproportionately burden vulnerable groups of people. Governments must show that such powers would actually be effective, science-based, necessary, and proportionate.
Other privacy activists say it may be necessary to use available data to help control the pandemic.
I am not against fighting this epidemic with data or tech. The problem with implementing surveillance in an emergency is that it might acclimate people to that.
Anonymity is possible. Cornell University researchers have developed Opendemic, an app that allows users to share their locations and whether they're sick without giving their identities. They can also receive alerts for potential and verified coronavirus cases near them.
Because of the lack of test kits, we need to rely on self-reporting, and the idea here is to have a database that can be open to public health authorities, so they can use that data in addition to the data they already have to make decisions about the right interventions.
Researchers say this virus will be with us for months to come, and until and unless there is greater uniformity and clarity over how data rights are being handled, privacy rights might become another victim to COVID-19.